Freeman,
Roll call.
Freeman,
Present.
Berkowitz, Costa, Dean Schlattman, Hickey. Here. Mitchell. Butler.
Here.
We have a quorum.
Okay. Can I get a motion to approve minutes for August 5th?
Second Hickey.
All in favor?
Aye.
Oh, we do a roll call? Sorry.
Freeman,
Yes.
Costa, Hickey,
Yes.
Butler.
Yes.
Motion passes.
All right, thank you. So on old business, last month we had animal control in, and there was a push to get a resolution to allow animal control to expand on what they have. So I'm not sure how, but it did not get on the agenda for this month. I think there was a private meeting and some stuff was talked about, but the problem still exists. So I am going to move public comment for this one item only to about animal control if there are no objections. So the hardworking civil servants can get back to work.
So you would need a motion to.
Well, we don't need a motion unless there is an objection. Because it's called unanimous consent. So if anyone objects to these people just giving their public comment,
So
then
is
we
it
will
all
move forward
public
with it. Just for this topic.
Per your rules, it says you can suspend the rules.
Well, that is true, but for the sake of speed, I just asked if there were any objections. If that way we don't have to go through the whole process and waste 10 minutes of time in order for the meeting to continue.
Per your rules. It says
Motion to suspend.
Okay. Yeah, we'll do a roll call. I'm sorry.
Freeman,
No, can I change that? I'm a no.
you're no. Okay. Costa, Hickey,
Yes.
Butler.
Yes.
Motion passes.
Okay, so anyone here for public comment on animal control, please take the seat and press the button and give us your name and where you're from. Yeah, press the button on that, right? Hold 1 second, I'm sorry. Okay,
Good morning, committee. My name is Ryan Allison. I am the Code Enforcement and Animal Control Supervisor for the Village of Crete. I do have some people in the audience as well from the Village of Stager, Village of Monee, and also the Crete Police Department. All speaking on behalf of the stray hold issue that we've seen as a reoccurring issue seems like it's across the county, but I'm going to speak specifically on the east side as well as our agencies. If anybody would like to speak up, I'll invite them up. But we have been having Crete, it's specifically has had no stray hold facility for about 2 years. I might be approaching 3 at this point. We've attempted to contact all our area veterinarians for assistance. Most don't have capacity or staffing to accommodate us. And then we've reached out to Will County Animal Control on a few different occasions, and they've reiterated the same sentiment, I guess, with staffing and capacity on the availability of taking in a contract on our behalf. So I'm asking on behalf of the Village of Crete and the East Side agencies that we get either Will County Animal Control some additional support to accept more contracts, or the potential for a East Side stray hold facility supported by the county.
thank you. Does anyone else from the audience want to speak on this?
So Deputy Chief Pete Feynman, Stager Police Department. Same thing as Ryan just said. For almost 3 years now, we have not had a facility that will take strays, specifically dogs. We were using the local animal hospital in town. However, they are a no-kill and they ran out of room. Currently, they have 9 dogs, one of which has been there almost 2 years. And their staffing, they have to pay staff to watch the dogs, they have to pay for food, they have to pay for everything else. So they're not accepting any strays from any other towns. We reached out to South Suburban Humane Society, trying to see if they would take dogs. They will not accept any new contracts. They already have multiple municipalities. And they said they will not take any more municipalities. So we're in a quandary. We don't have anywhere to take them. We have contacted both, since we are a split town, we've contacted both Cook and Will County Animal Controls. And it's pretty much the same, everybody has nowhere to take dogs or cats or any type of strays. So yeah, if we could work on something to either expand or get a facility out east, that would greatly help. Because right now we're at the point where if we get stray calls, we're not able to answer them because even if we catch them, we have nowhere to take them.
So is it my understanding that you have at least some sort of animal control program, you just have no ability to house them?
Stager does not have animal control.
So this is handled directly just through the police
Our
department?
police department handles, yeah.
Okay.
Yep.
Is there anybody else who would like to speak on this?
You're on again.
Yeah, you're off. Go ahead. Hit it again.
My name is,
Gotcha.
okay, sorry.
I'm
Hi,
going
I'm
fast.
Detective Evie Lazzarone. I work for the Moni Police Department. We do not have an animal control program. We've never had an animal control officer. Currently, all of our officers are kind of trained by myself. I do our animal abuse investigations for the department, so I've kind of had to train them on how to take animals into custody. We were able to get a contract with South Suburban, but it's kind of restrictive. So if we get an animal on a Friday at 4:30, that animal will stay at our police department until Monday morning. So I kind of had to finagle and turn one of our juvenile rooms into an animal room. Our guys have to take care of these animals during their shift in between calls, which, as you can imagine, is a little inconvenient when we get busy, when we only have a couple guys on the street. We've personally had to keep a cat at our facility for 6 months. We turned him into a station cat and adopted him out, which was a nice ending, but it's not very convenient. I have reached out, and the deputy chief has reached out to Will County Animal Control probably 3 times, I think, in the last couple years to try to get a contract, but we were told that they are not accepting any new ones. So if there were a way for us to have like a facility close to our side, I know I can speak on mine, and I know Stager, we have a microchip reader. One of our things is we really post it on our Facebook page. A lot of times, I'd say probably 90% of ours, we can find the owner, but it's that last 10% that you're kind of stuck in limbo where in my case, our officers are becoming, animal control. And that's really hard for the department. Currently, our contract with South Suburban, right now, it's a 3-year. We pay $250 for the first year, $375 per animal for the second year, and $500 per animal. We just had a mom and 6 cats. So in 3 years, do the math. And I try to help the chief with budgeting, but you really can't foresee it. As the years are going, our stray calls are becoming higher and higher. We have them almost daily, definitely weekly. So it is a problem. We're trying to educate our community, but you can only do so much. So Thank you very much.
Thank you. So first, before I say anything, is there anyone else that wants to speak about on animal control, the topic of animal control? Okay, so I just want to say that a lot of these municipalities that are coming in here today are from my district. So obviously I get a lot of calls. Frankfurt is also in the same predicament. They have tried to do a intergovernmental agreement and they have not been successful. And like Steger, they and Moni, they do not have animal control. Creed is at least willing to do half the work. They just need help to try to get, housing for these animals. I think that this is a topic that needs a lot of attention. It's not just one town. We're talking about 4 different towns in just one district. And that's the only ones I know of because that's my district. And if there is, right now, I thought this was solved. There was supposed to be some place that was taking in the animals. There was a money that was given. I thought it was like $250,000. But apparently those only service the 9 intergovernmental agreements that are made with the county now. So I don't know who those towns are that got that, but certainly I feel that if 9 get it, they should all get it. Especially keep in mind, these intergovernmental agreements are not asking for handouts. They're asking for help. They're going to be, pitching in and paying money too to help cover the costs. So it's a real problem, and I think it needs attention. And I want to thank all the people that came in for giving us your story and telling us where your villages are at. If there's anything else that you need to say? Yes, one more. Okay.
Hi, I'm Caitlin Thierry. I'm an officer, animal control officer for Crete. I think when it comes down to it, it seems like a small ideal to you guys, but when it comes down to it, we're trying to make it safer for people that are, on the streets. I get calls daily about dogs running, and the first thing I think to myself is it alive? Is it dead? Where am I going to put it? Right? And I have an agreement that if it's dead, obviously I have somewhere to place it. You always go to the call and you think to yourself, gosh, I hope it's either ill, because then at least I have someone that'll take it, or deceased, because that's it. And that's a really messed up mentality, because I don't have anywhere to put these live animals. It's not their fault. They're running at large. It's not their fault that, someone lost them or grandma dropped the leash while they were walking. So when it comes down to it, it seems like it's such a not a big deal, but I'm out there every day trying to make it safer. And it does become a public nuisance, to the point where if the call isn't going to be answered, I hear it all day, every day. Well, we don't have animal control, so the dogs are just going to have to run at large. What if the dog's not friendly? What if the dog mauls a kid? Then it becomes a problem, right? Then it becomes oh my God, how did that happen? Why didn't someone stop it? So I think that's where, when we come together as a town, I think to myself, how can I make it easier for other people? How can I stop it? And I have I would say 90% rate, like they were explaining in Moni. I can try my best to find the owner, but when it comes down to it, maybe I have 30 dogs a year that I can't find the homes for. And that's the ones that are dumped in our area. We're semi-rural. We have, we're right off 394. I had 2 dogs that were thrown from a moving vehicle. So they are lost. No, they're not. Someone didn't want them. So I think that's where, when it comes down to the nitty gritty, is what can we do to stop it? I have dogs that when the buses are being let out, I know that the dogs are there. So I'm constantly, monitoring that area, making sure that the, gates are closed, stuff like that. Our job sounds always like, oh, because, but, we're the little guys, right? But when it comes down to it, and you have that call and you have that, like a personal, like, you found this dog and now what am I supposed to do? You call and they say, well, we don't have animal control, or we have nowhere to put them. When it comes down to it, what are we supposed to do? I'm not saying to make it a no-kill shelter. That's not what I'm saying. I'm not saying to any animal that needs to be put down. No, but it's no life to be there for 2 years or 3 years or 4. That's no life. They have to learn that it's a hard job. I've been doing it for the last 20 years in the animal medical field. It's not easy, but we have to make a decision, right? We have to make a decision to make it better. So I'm not asking them to run around and grab the dogs. That's my job, but I'm asking somewhere to put them. So I think that's really when it comes down to it. We just need help. That's it. And
We'll do our best.
that's all I ask. Thank you.
All right, thank you very much. Okay, is no more comments for animal control? Okay, I want to thank the committee for allowing us to get them in here like this, and you're welcome to stay for the rest of the meeting. Otherwise, thank you for coming in. Okay, we're gonna, yep. Mhm. Okay, next, new business. And we have 25-2647 presentation, Will County Cares. I believe Vince brought this forward, but our Joliet Fire Chief, Jeff Carey, is going to come and present. You're going to speak for him? No. Oh, you're going to speak? Okay, go ahead. Oh. There we go.
All right, so thank you, Chair Butler. Probably about a couple months ago, I had an opportunity to meet with the chief and he explained this program to me. And as a former first responder, I absolutely love this program. 20 years ago, when I would go to a call that dealt with mental health illness, we had no options. And I'd go to calls over and over and over again. So in talking to the chief, he outlined this program. I love this program. I don't want to steal any thunder. What I've done is I have asked the chief if he could come. He unfortunately can't make it today because he's in training, but he has sent representatives from the fire department. Everybody has their attachments. They have the resolution that I was putting forward. You guys have the health program brief, and you also have like a training manual that goes with it. So you guys can look at that extensively if you want. But I thought we'd just go right to the horse's mouth and have one of the people here that actually developed the program come and talk about it. So if you're okay, I'd like to invite them up and they can identify themselves and say something about the program. Is that okay?
Sure,
Okay, cool.
absolutely.
So we have today members of the Joliet Fire Department. They can come up and they can say who they are and kind of explain this program in a nutshell. It's a huge program. Right now we have it very centralized, but this needs to go countywide and they're going to tell you why.
Okay, so first, hit your buttons so I can load you up here. And yeah,
All right, thank you for having us. My name is John Cook. I'm the Deputy Chief of Human Services for the Joliet Fire Department.
My name's John Lukancic. I'm the Director of the Office of Emergency and Disaster Management for the City of Joliet. Together, all of us put together this program. It sounds like you have the general idea in your documents today. But we just want to kind of come and describe sort of in a nutshell quickly what we did, how we did it, why we did it, and what some of the results of it were. So what we did is we figured out through our fire chief, and he sends his regrets that he can't be here today. But what we found out is a significant portion of the calls in the city of Joliet for ambulances were for mental health issues. So as part of our risk reduction strategy, we put together a program to try to address those things. So we studied the problem and we realized that we had three major issues with mental health. First was access, second was transportation, and third was cost. So we needed to figure out a way, as you already heard, these ambulances continued to go to call after call after call, day after day after day. They would go to the hospital, they'd be released from the hospital, that 3 days later, they'd go back to the hospital. And then next thing you know, this is happening hundreds, maybe thousands of times a year with different people. So what we tried to do was figure out exactly what the problem was in Joliet. And when we came up with those three things, access, transportation, and cost, it came to light that some really tough things were happening. Number one, in the city of Joliet, in order to get a first appointment with a basic mental health care provider, that would be a social worker or a counselor or a psychologist, it was taking 4 to 6 weeks for your first appointment. And this is back in 2021. If you needed advanced care from a psychiatrist, medication administrative treatment, we're talking 15 to 16 weeks, 4 months for your first appointment. So access was a big issue. So we tried different ways to improve access, and it was just a struggle, okay? So when we focused on access, we realized that we needed a way to get people the definitive care that they needed that they weren't getting. So that person who was using the ambulance and the hospital for their mental health care we needed to get those folks definitive mental health care that took the ambulances and the hospitals out of the equation. Okay. And that's what we finally did. And when we get to the how, what we did is we had to find partners and we had to find funding. Those were our big issues. So when looking for partners, it actually was kind of serendipitous that we found a partner in the form of a place called ThriveWorks, which is we've had a public-private partnership. So ThriveWorks actually came to the city of Joliet. They're a private group and said, you know, we're looking for ways to help your firefighters and police officers out. We would like to make our clinical program part of your employee assistance program. Well, Chief Carey, God bless him, he says, well, that's great. Let's do that, but let's also see if we can make ThriveWorks available to everyone in the city of Joliet. So that was our goal. That's what we did for the next 18 months, was figuring out a program to do crisis intervention in the field, and then get them to the definitive care that they needed and get them there as soon as possible. So in terms of access, when we partnered with ThriveWorks, we fixed the access problem, because between telehealth and in-person, since we partnered with Silver Cross Hospital, they gave us an office at 1051 Essington Road in Joliet, which is right smack dab in the geographical center of our city. So we actually had an office that people could go to. So they had access. If they couldn't get to the office, they had telehealth services. So now they had access. If they had transportation issues, telehealth handled that wonderfully, because they could sit in their living room and talk to that licensed clinician. Now, the final problem was cost. When we got to cost, we had to figure out how were we going to pay for this all, because a lot of people can't afford mental health care. Either they're underinsured, they're uninsured. Initially, we went to try to get private donors to try to fund this. And that was working well until one of our private donors said, well, why don't you go to the city and ask the city for the funds? And we did. We went to the city of Joliet, and they actually offered $400,000 of funds to pay for this for the first year. And then they voted again the following year for another $400,000. So now we had access, transportation, and cost all taken care of. So starting in July of 2022, in the city of Joliet, mental health care for all Joliet residents was cost-free to our residents. So if you had insurance, it was probably covered. If you didn't have insurance or were underinsured or had a copay, the fund that the city set up actually paid for that. So no one since 2022 has had to pay for mental health care in the city of Joliet. So these partnerships worked. We had the partnership with the hospital, the fire department partnered with the hospital, partnered with ThriveWorks. And then we got the areas of education involved, like the high schools and the grade schools. And the high schools especially started working with our folks too. They established a fund, and they were actually able to take care of kids out of district and all this other stuff. So when it comes to the results, we actually have had some very, very good results when it comes to this program. First thing is, with our program now, the way Chief Carey structured it, he actually has secured a grant to fund this program. And I use hand quotes because we're talking a state grant to fund this program in all of Will County. So as of right now, everyone in Will County is covered under mental health for cost-free mental health right now. So that has started at the state level. Now, we all know sometimes there's some challenges with state funding and how all that stuff works, but right now that exists. But the primary thing I want to mention, and I'm just kind of saying descriptive statistics here. In Joliet, since we started this program from 2022 to 2023, our suicide rate dropped 31%. From 2023 to 2024, it dropped another 27%. So every year since we started this program, our suicide rate is dropping by almost a third, which is great. So we are having some very good results with it. We're having some very good anecdotal reports from citizens and students and kids and family members about how this is working for them. But what finally came out of this is we developed a program called Crisis First Aid for Paramedics. It's a program we put together because we realized that crisis intervention in the field is the first step on the continuum of care to getting people where they need to go. So just like a paramedic would treat someone with chest pain who's having a heart attack, that paramedic doesn't fix that in the field. They start the continuum of care, they stabilize the patient, and they get them to somebody who can help. That's what we're doing in the field in the city of Joliet. Our paramedics, all of them have been trained in this crisis first aid for paramedics program. And thousands of times since we've started it, they've gone out, they've mitigated the crises, they've helped people deal with things, and they've gotten them to the next step, which is where they need to be. In terms of definitive care, Chief Cook can talk more about that. But right now, the people who use our program, we're filling 1,000 appointments a month at ThriveWorks, just for people who are getting mental health care. And you've got some more specific numbers, Chief Cook, right?
Yeah. Well, it's hard to tell this any better than John just did. But we'll give you what we're seeing as a benefit to the community and the fire department, the city of Joliet. I went back and looked at 5 years of our stats for psychological and suicide calls, even though the program has been in effect for 3 years since July. The interesting thing is our psych calls and our suicidal calls have stayed relatively level. They've dropped a little bit, but our call volume since 2020 has just gone up increasingly. So that's a good stat. It's showing that mental health is not increasing. We've seen a significant decrease in our what we call high frequency users or super users, meaning they call 911 for just about every reason. What we found were people were calling 911 about every 3 days for mental health calls. And the reason was because they did not have their own doctor and they didn't have access to medications. So they were using the ambulance for a ride because, like John said, they also did not have transportation. We were taking them to the emergency room while they were in a crisis moment, generally, because they've been out of their medications. The hospital would give them about 3 days worth of medications, send them on their way, and the process would repeat. We've seen a very significant drop in our super users for 911 in mental health and suicidal calls, to the point where our fire crews would do wellness checks on them because they became worried. They're used to seeing this person 10, 15 times a month, and now they haven't seen them in months on end. Let's go check on them. And they would say, hey, no, I don't need to go to the hospital anymore because you guys helped us get the mental health I need to take care of problems. That is an amazing stat. So while our call volume is going up, our mental health and our suicide volume is staying stagnant, which is a good thing, or it's going down a little bit. There's always those little spikes here and there, but the good news is now we know where to take them and what to do. We've also noticed that our uninsured people, for a lot of reasons, because they couldn't be employed or what have you, have switched over to being insured. Now, the evidence is there that they've become well enough to either manage casework to get the state aid that they need, or some of them actually become employed now, gainfully employed, and they're able to work and get the insurance they need. So there is a definite benefit. The problem is people need help. And even though we solve one person, there's going to be another one waiting. And what we have to send the message of it, you don't just have to be in a crisis moment, a depression, suicidal. It could just be you have anxiety that's stopping you from living a good life. Maybe you're not sleeping, this and that. And these are the people we also give help for, and we find out they need 1 or 2 appointments and they're straightened up, and then now they're living a good life. So again, we've seen a good drop in our call volume to the fire department for that type of call, which is, it speaks volumes for the program. We are having issues now, though. We have to be able to find help for people who are uninsured because it's becoming more and more difficult. Some of the private clinicians do not take uninsured people or state aid. We've been able to work with the Will County Public Health Department. We've recently made a referral to them, and they've accepted it, which is a good thing. So we're really hoping our partnership with them can develop. And there's some other agencies in the area that can help as well. But we still need to find that access, the counselors and the funding for it.
You guys have any specific questions?
So, yeah, as long as you're done giving your presentation, we'll take some questions.
Let's hear
okay?
questions.
Oh, I could keep going.
Yeah,
if
we
you
go
want.
for hours. This is like a 2-hour. We actually speak at conferences about this. We can go.
Okay, so we can start with 7 here, right? Let's see.
Thank you. This is exciting. I'm really glad to hear about this program. Do you have enough mental health providers? Do you see a need to perhaps bring more into the program?
Yeah, there is definitely a need for more, like I said, because the caseload is high, and we also have the need for people who are either on state aid or uninsured, and that does become tricky, which thankfully the city of Joliet has helped out, the Southern Way Board's helped out as well. But yeah,
The
we need
second
more.
thing I was wondering about is, mental health, these issues kind of take a toll on the whole family. Do you provide services or support for the families of these individuals? Because one of the greatest hurdles you have is how do you support your loved one? A lot of people, they don't know what to do. You're afraid to do anything because if you do something wrong, so that's a real common, a common issue that you come across when you happen to have a family member in distress. Are those resources there? Do you have something in place?
Well, for mental health, everybody in the family is covered. So if they're having mental health challenges related to the mental health challenge of the person who's seeking treatment,
Mhm.
they have mental health resources available to them. Chief Cook can tell you about some of the other resources that are available through his program as well. He runs the Community Risk Reduction Program
Mhm.
through Health Services for the City of Joliet. So there is a wide ranging service availability that the City of Joliet has access to, if you want to talk a little bit about
Yeah,
that.
you know what, that is a great question, actually, because the family's forgotten about in
Mhm.
this event. Everyone focuses in on the victim or the survivor of what event took place, and we forget the family. So like John was saying, our paramedics are all trained to crisis first aid. John also developed this manual that started the start for the fire department of knowing where to look and where to go, which is the manual that's up on your screen right now. We used to hand this out to the people and kind of direct them a little bit through it, but we realized that when they're in the moment, when they just witness something traumatic, they're not going to be able to focus on it. So what happens is our paramedics provide crisis first aid, and then they provide them contact information to us, but we also immediately get notified through their reporting system that this family endured this event, whatever it could be. It could be a fire, it could be a suicide, it could be some just traumatic event that they watched or have gone through, or they just have basic needs issues, whatever it is. Our social worker, our community paramedics reach out to them within about 48 hours, sometimes 72. We kind of gauge what the call was to see if that person might be ready to listen to anything yet. So we're not overwhelming them with more phone calls, right? Our community paramedic and our social worker will go do a house call, and we'll do a wellness check on them. And then from there, start to figure out what the other needs are as well, whether it's basic needs or it's more psychological needs. So she'll,
Just have one more.
Oh, okay, one more question.
Yes, thank
I'd just
you.
like to let everybody
Yes.
speak and ask some
Thank you.
questions, and so it doesn't get monopolized.
So one
Hold on a
other
second, let me,
thing.
I'm sorry.
So a pretty critical age for our children, and it impacts the parents, is, early adolescence. I know at a middle school level, those student resource officers are vital, vital. They kind of are the eyes and ears about what's going on right within the school environment. Some schools, I don't know, they were in the process of reducing that resource. And I don't know where it's at today within different districts. Are you working with them or can you collaborate with those student resource officers to help that part of the population?
Well, by and large, we've been collaborating with the administrations of the school districts. So they're the ones who run their district,
Mhm.
top to bottom. So if they want us to collaborate with their, we have a lot of staffing issues when it comes to police officers in the city of Joliet. So there may not be SROs
Yeah.
at schools. So what we've done is we've met with the administrators of the school districts and tried to make our services more easily available to the students. For instance, at Joliet Township, everybody gets a laptop. Joliet Township High School, a QR code to our service actually pops up on their homework page. They can actually take a picture of it and make an appointment for mental health screening at the time, and if they need it. So there's a lot of ways to do that, and consent is gotten for that at the beginning of the school year when parents are signing all the forms for their kids. They put a consent form for mental health care in there. So they have access to mental health care whenever really they would need it.
So John and Chief Carey and Chief Kozlowski did an amazing job getting us into the school districts and getting the programs going to the point now where the school teachers themselves or the districts will reach out to us, especially coming into summer and saying, we've got X, Y, and kids. They're going to need some help. Can you guys keep tabs on them throughout the summer until our social workers can pick it back up? So the relationships are there for the most part.
Thank you. Board Member Costa.
Thank you, Chair Butler. It's wonderful to hear from both John and John again. Early in the program, it was around, the start of 2023 when the Will County Community Mental Health Board had just formed. You all came out to speak about the program in its kind of early inception. And Chief Carey came to our meeting last month and provided a progress report on all of the work that you've done. And I don't know if the Public Health and Safety Committee is aware, but the Joliet Fire Department received national recognition through the Congressional Fire Services Institute for the work that they're doing. So I think that the city of Joliet has really done a tremendous job to be a model and to share what they've learned through Chief Carey and all of the chiefs and John, the innovation and the vision that you had to expand this program and the amount of collaboration. And I think that there is a vested interest by so many stakeholders and advocates, by members of the board, by the health department, by the school districts, as you all have mentioned, to keep this program alive and to expand it in some way. And so I am interested to know, is there a specific ask that you all have now in ways that we as a county can continue to support this program? Because I would like to see this, expand beyond, the townships and the municipalities who have a lot, I think, to learn from Joliet, but then are also trying to implement their own programs today. So how can we do that and how can we be helpful?
I'm sure John will agree and he can expand on it, but there's two things that we really need to help really the whole county. We need partners who can actually provide counseling at all levels and they have availability and they're taking clients, especially those that might be uninsured, especially.
Right.
And then we need help with funding to keep it going. The funding it will take to actually get these programs running will save money down the road in terms of cost of work, things like that.
Yeah. I guess I just want us as, as members of this committee and as county board members to kind of remember what Chief Cook had said here. The funding is necessary and required, and we want to continue to find ways to support that.
And you know what? The county's already done a lot to help us. Chief Carey came before the 708 board and
Yes.
he got the grant for,
Yes.
for I don't know how much it was for, but to help along with this program. I think it was 200,000.
Yeah, 200,000.
So everybody is working collaboratively and I really love it because everybody, the Will County Health Department, the 708 board, the county in general, the city, everybody is coming together, the school districts, and that's what we need for this to continue
Yeah.
to work. Is this isn't a one entity thing. This is, we
Yeah.
all have to work together to get this to be maintained and to be successful.
And I know the Community Mental Health Board in the early start was looking for kind of cornerstone programs that could really make a direct impact across the county. And we dreamed of something like this, and the model that you've provided, I think we will really be able to support both at the county level and the different funding sources too,
Great.
like the Community Mental Health Board. Thank you.
There are multiple fire departments who are trying to follow the model in the
Yes.
county. So they're all on board and they're looking to help and make their residents thrive.
Okay, Board Member Hickey, you have the floor.
Thank you very much. I appreciate it. Thank you all for coming today and thank you for sharing this. I think mental health is very important. I myself am certified in mental health first aid. So, and that's great. Everyone can get access to that if they choose to. There's some classes that are usually offered. I know that there's also a crisis level that you all have incorporated, which is great. I'm just looking at some of the information and how do people access this program? I heard the QR code for students,
Mhm.
but
So they've got a lot of different options now available to us. One, the crews inform them, our first responders, when they go on calls, whether it's a police, fire, or paramedic. We have our Community Cares program, which meets on the first and third Tuesday of every month that involves a lot of different social agencies. Some, about 30 or 40 show up to our meetings, and we share clients. So if they need additional help, we can get it from that way. The public can go in through joliet.gov through the city website, and there's we call them buttons. There's a little red button in there they can click that says community cares or community programs. And there they can fill out a very easy form, just saying what their needs are. And then it notifies us immediately that somebody's looking for help. And then there's also a phone number they can call, and that's 815-724-3506. And that leads directly to our mental health community risk reduction staff.
Okay, how is that communicated to the public? Like, is there a PR campaign that you guys have done? Is it?
So for the most part, it was done through our crews when they'd go on calls. And then when we'd go to different events, whether it was the fire department was at social activities like block parties, things like that, or whether our staff was actually going to informational meetings.
And a lot of what happened after the initial kickoff, it sort of grew organically. And it, friends tell friends and family tells family. And the next thing you know, thousands of people are calling for help. So I think word of mouth was the biggest way that this spread. We tried to advertise on billboards. We tried water bill things. We tried internet and social media. But I think it was word of mouth that got it moving the way it needed to go. And you know what? We helped one family member. Well, gosh, my cousin needs help too, and my son needs help. And then the next thing you know, we've got large groups of people who are signing up for services. So I think that was the best way.
We're fortunate enough now to have a communications department who's highly interested in advertising this for us. So we're hopefully going to see much more response from that.
Okay, so what is the population of Joliet? I'm
A
sorry.
little over 150,000.
Okay, and how many people are actively in treatment at a time?
That's that we got about 1,000 people in treatment at
Okay.
any given moment, roughly. Now that number, I'd have to check that to get more accurate for you, but it's right about there.
Okay, so I did a little looking, I just rounded some numbers. Our population in Will County is around 700,000 people, right? And using the rate that's referenced in the resolution, I use the lower rate, the 1 in 6 people, children have mental health needs. And since I didn't have it separated out by children and adults of the population, I just rolled with the lower one. And what I'm understanding, there's a $1.9 million grant. And where is that coming from?
That's funded by the state of Illinois.
Okay, all right. So, I mean, looking at that, we're talking about well over 100,000 people in Will County who would need care for mental health. And I looked up the self-pay rates for ThriveWorks because I couldn't find anything about contracted numbers. Do you know what your contracted price is?
You know what?
I think we're at 120, aren't we?
It's going
120.
Yeah, there's going to probably be a change to it, but yeah, right
Okay.
about there.
In their information, they have self-pay for intake is $200 to $240 an hour. Follow-up visits are $160 to $195, and then it's more for psychiatric care.
Right.
So I did math, and it's not my strong suit. I'm just going to tell you that it is not my strong suit. But when I look at $1.9 million, I want to let you know how quickly we can burn through this. That would be 6 minutes of care for everyone who would need care according to NAMI's. So, I mean, we would need a lot more funding in order, because I hear you saying 1 or 2 visits for some people. There are some people that it is a lifelong issue.
Correct.
And I'm just concerned that, is there a means testing? Is there, like, how do you decide?
Well, keep in mind too, that if we sort of use the 21 to 23% of the population requires mental health care, that would mean that 35,000 people in Joliet, we're not near that number. So I think the numbers are a little inflated of assuming everybody who needs the care is going to seek the care. So I don't think that's the way it generally is. So I think a certain percentage of the population will seek care, but I don't think every man, woman, and child who needs mental health care is going to seek mental health care. So I don't think it's going to cost it's not going to cost, I don't think, as much as if everybody sought that 1 in 6, if every single one of them, yeah. So we kind of have to temper what the stats say with what realistically we can expect to sort of happen. And only a certain percentage of the people are going to seek that care. So, and then when we talk about seeking the care, we need to check to see also who is actually covered by insurance, Medicaid, things like that, because that takes money out of what you have to pay. So you're not paying top dollar for, and our rate right now, it's not the 200. It's lower than that, Joliet's rate.
Sure.
So you're not paying that top dollar. And also not everybody's going to seek treatment. And number 2 and number 3, many of the people are going to have insurance or Medicaid, and they're not going to be full blown. You have to pay every dime sort of thing.
Right,
And to-
okay, and with the concern about Medicaid, I understand you're looking for providers that can do that. If we're looking at providers locally that are going to do that, we have grave concerns that the Medicaid expansion program is going to collapse. And so we're really, it sounds like we would give maybe people with more ability to pay or with insurance backing to a private company, and then we would kind of saddle our local health departments with people who will be uninsured.
There are agencies that can assist that, but yeah, that would be one way to take care of it.
Agencies, I'm sorry.
There's a few out there. We're working with a couple right now. They're not a lot of them. I can't tell you that there are a lot.
I mean, because we're looking at some really big
Yeah.
issues, and this is a big issue. So the other thing is, I heard you say that you brought in ThriveWorks initially for the employee assistance program, which is great.
Well, that was the initial intent of it. We didn't bring them in for that. They came right in for the public.
Okay.
So that was their idea to come in for EAP.
How did you vet that company?
Well, the company itself, they had a rep in the area that we discussed with, and we had weekly meetings for a year about what the company can do, what the company couldn't do, weekly updates of the process by which they were changing to suit our needs. But everyone who is a clinical provider is a licensed clinical provider in the state that they operate out of. So our primary vetting process for that company was they had at the time they had, I think, 4,000 clinicians nationwide. And in Illinois, they had a large number. I don't remember the number offhand. But
Yeah.
but the primary vetting is, are they licensed?
Okay.
If they're licensed in the state of Illinois, the clinicians are vetted by the state of Illinois. The company, we knew that the company was active in 35 different states when we researched the company. So they were a viable and reliable company so we vetted the company that way by researching their background. But each individual counselor, since they are licensed, they're essentially vetted by the state that they're in
Okay.
because by virtue of the license.
But the
Okay,
company
just for a
itself-
second,
I'm
Can
sorry.
I just want to let everyone know, I want to get through 2 or 3 questions per person, most important ones, let it go around the table and then another one. I don't want to get monopolized too much into conversations. I know Mike has been waiting a long time. We'll get back to you after that. It
Thank
just,
you.
And I can
wanna
talk
keep
to you
it
after
moving
too.
and then
Be happy to answer.
respectful
We'll
to
stick
people in the
around.
crowd. We have a whole hour presentation ahead of us, I think, with the health department and Sunny Hill. Michael, you have the floor.
Thank you. Thank you, gentlemen. I have heard great things about your program as well. I was chair of public health and safety. I've been on public health and safety for 5 years. So I have heard about you. So you're getting your name out there. Also work very closely with the health department, sit on their board. Dr. Burke and I talk on a pretty regular basis. It's mentioned in, I don't know where to start. I have a whole list. I'm sorry. You started in 2022, it's 2025. Do you have statistics on your
Yes,
program?
we keep pretty close stats on our community risk reduction division.
Would it be possible for you to share those with us at some point?
Absolutely.
Because that would be great.
Was there something specific you were looking for?
Well, it was, it's talking about, I think my biggest part of the resolution is it's kind of giving you credit for the 50% decrease in the suicidal rates, which we all know it's a collaborative.
Yeah, I don't take credit for that.
Collab-
That's a
it's
descriptive
collab-
statistic.
it's
That's not a
definitely
cause.
Collaborative.
That's not a causative
As I look
statistic.
at
That's a
Dr. Burke,
descriptive
I would never,
statistic.
she
Yeah.
threw something at me, so.
Yeah, I never,
It is
I never
definitely
take credit for
collaborative.
that stat. All it is a descriptive statistic to say what's actually happening.
Right.
It's not a cause effect. It's just interesting that it's happening.
Yes, I mean, if you could show us, how many people have been touched, how many people are continuing getting services, anything. We have nothing at this point for this, so I would like some information. And that, stats are a wonderful way to look at things, like,
For sure.
in 2022, obviously you didn't have any, but now it's 2025, and Thrive, I'm assuming, is helping you keep some of those statistics.
So to clarify, you'd like to know how many people are like for one appointment and done or continuous treatment?
Pardon?
Do you want to know how many people did one appointment, how many people are continuous, or what are you looking for?
Yeah, and how many have been denied would be great. I don't know if you have that, but
The only time we would deny somebody, excuse me, is it because they're not a resident of our city or they're not a resident of one of the other townships that partnered up. But when we deny them, we just deny them our funding. We still provide them access into the program so they can get some of those benefits, or our community risk reduction group will go out of their way to find people in their area to help them.
so that leads me to another question, which is down the list, but it's, you have some partnering townships and villages and communities. Are they all part of your taxing district, or are you outside of that area now?
The people, when I say they partnered up on our program, say, for example, Beecher Fire Department or Lockport Fire District, New Lenox Township, Lockport Township, I'm sorry. They use their own funding, but they did their best to mirror their program after hours. So when we come into contact with their residents, we will point them in that
And that
direction.
was before the state funding started. Other townships would say, well, we have money for this. A lot of municipalities and villages didn't have money, but townships did. So they asked us to come to present to the townships to say what we're doing in Joliet. So we went to quite a few townships, I think maybe 8 or 10 in Will County, and did our presentations. And before that state funding came through, those townships actually decided to fund the program. So yeah, some of them, we were all way out in Beecher. So they were way outside our taxing area. But each of those individual townships started to buy in. So that's where a lot of the funding came from. Once the state funding came for the county, then the townships were given a little alleviation from that, because now the whole county is ostensibly covered under this grant.
And with that 1.9 million, you obviously have a plan for it to spend it? And I'm assuming it's just a one-time thing, a one-time grant, not a continuation, or?
It looks like the state wants to kind of use it as a pilot program to see what
We
the
like
benefits
this.
are, right? So once it's actually released to us, we'll be able to start managing it for the group
So
of people.
for that 1.9, is it possible to share with us like the plan for how you're going to disperse that, and kind of like, where is it going? What's it going to be doing, kind of thing?
Yeah,
For sure. Yeah.
That would be
definitely.
nice too. I just need more information, because it's big and it's massive.
Mhm.
And you've told us that you're going to need money, but you really haven't told us how much. So I'm trying to just get a feel for it. So I do have more questions, Dan, but I'm gonna go ahead and let you go ask others.
I just want to say, I see you have like 11 questions, so.
Yeah, but they're
I'd like
not-
to be very
they're not-
concise and no follow-ups,
They're
okay?
Well, like, keep in
not
mind,
related to
Just
keep
make
in
them
mind
concise
right
and
now
one-
that there
one
is
answer
no
per,
ask
for each.
at all from you
What?
right now for money.
Okay.
There is no ask.
We're just here to describe. the
Yeah, we're
program.
just here to talk about what the program is. So we're not asking you
Okay.
for any money right now.
Okay, that's important, because
Right
it's
now.
like.
There you go.
Yeah,
Little footnote to that.
all right. I thank you for your time. I will let others ask questions.
Oh, you done?
I would.
Okay, Kelly, did you have a few more questions? Okay, again, just concise and,
I will do my very best.
I appreciate it so much. You don't know how much. Huh? Okay. There you go.
Thank you very much. Okay, going back to ThriveWorks and how it was vetted, I looked at some information, because I was looking at, I was previously at Wheatland Township and I was working, trying to get that program there. I got a lot of pushback from my colleagues on the other side of the aisle, and I did really, really try. But when it looks like, when we talk about ThriveWorks, it looks like, you know, Better Business Bureau, Trustpilot, Reddit. I mean, I don't know where to go for result, but I'm just asking, like, how do you keep a handle on the product that you're offering these people? Because there's some pretty serious accusations that are out there on social media about this company specifically.
So we have regular meetings with them. And then when we have issues, we reach out and talk to them. They actually came and seen us 2 months ago, a month ago. They came into town, spent a day or two with us, going over stats and what's happening. We sample through our community reduction program. We'll randomly call people we know that we've referred to treatment.
Okay.
So the only thing we find out is, was the referral accepted by ThriveWorks and did the client pursue it? Once we know that happens, we stay out of it for the most part, other than to know there was X amount of appointments from client so-and-so without us knowing who they are or what their diagnoses are. What we do though is our social worker, our community paramedic, or our chief of community reduction will just randomly sample. Hey, we know we referred 20 people this month. Let's reach out to 1 or 2 of them randomly and see how their appointment went. Did they get in time? How did it go? And then when we do hear of problems, we reach out. If they had problems getting the access, what have you, we'll reach out to the powers that be over at ThriveWorks and find out what's going on. Sometimes we find out it was our people's issue.
Okay.
They didn't.
And after every single appointment with ThriveWorks, customers are asked to rate their experience, and they consistently come back high.
Okay, that's
Yeah.
good.
The biggest complaint I've heard of so far is that they could not get in fast enough to in person, where they preferred in person instead of
Right.
virtual.
And, you know, that's something that we looked at was the brick and mortar versus the, you know, remote aspect of this. One other quick question is just, you know, one of the accusations online, and again, this is social media, so I don't know how seriously to take this, but I am concerned when we're looking at saying, like, we can provide healthcare, mental health care for all of Will County through this program. One of the things is that there is some talk, specifically on Glassdoor, about the fact that there is dumping of patients who have suicidal ideation because the company has an internal policy against that. I don't know how seriously to take that. When I look at the numbers of, you know, it looks like there is definitely a change for the better, and I think that's great. I just want to make sure if we were to expand this program, that we have the option of making sure that, you know, I mean, from ThriveWorks side, it's kind of a great deal, you know, but they were the only game in town. That was the only thing that was offered to me as a possibility at the township. So are there other companies that do the same?
So we're working with them in the private world, and John can probably explain this better because he was in the beginning stages. There's not a lot that take public insurance. So that's been an issue in ThriveWorks. In the beginning had said they'd be able to make that happen.
But they're
And-
not anymore?
They're not at the moment, no. So we're just picking up the tab on the uninsured.
Okay.
And one of the issues we've been told is there's so many varieties of public insurance in Illinois, it became hard for them to deal with. Right. So we have been on the lookout for other companies because we realize if this program expands that we're going to need more partners. They're just not going to be able to provide all those counts.
Yeah, and we've known that from the beginning.
Okay.
That they're gonna, you know what, ThriveWorks is not the be all end all at this point. We're talking a large increase of potential patients here. We talk about working together. We have access to resources countywide that we don't have in Joliet. So the county has lots of great mental health resources because it's got so many people and it's so big. So we're going to be looking for partners from everywhere to make sure that we're covered. So yeah, we don't want ThriveWorks to be the only game.
Okay.
And as a matter of fact, we had a great conversation with Will County Health Department, and you know we are constantly looking for partners for this.
And
Absolutely.
To your concern, one of the things the Joliet Fire Department is deeply vested in is in follow up and follow through, which means we stay in contact with whoever we're using to make sure they're doing what they say they do, and we hold them to the fire. figuratively, right?
Okay.
But
good.
we definitely, we're not afraid to tell them that we will look elsewhere if you're not keeping your promises or helping our people.
Okay, and then auditing the charges, because there, again, there's speculation about fraudulent charges and things like that. So I wasn't sure, is there some mechanism to do that?
We get a monthly statement of how many appointments there were versus what's being paid out because we have to pay that bill. So we can watch it that way. I know Chief Kozlowski and Chief Curry watch it very closely. And then we do check in with our clients to make sure they're going.
Okay, thank you, thank you.
Thanks. Okay, Micah, any follow-up questions?
Yeah, I'm sharing my time. I'm back. It's mentioned that you, the University of St. Francis as an educational,
Can you say that question again, please?
how is the University of St. Francis
In terms of what?
part of your program?
So we partnered up with University of St. Francis and Lewis University. And for a short time, it was Aurora University, but we haven't done anything more with them to allow their social worker interns to ride with our fire department, our social worker, because she's a licensed clinical social worker. That way they,
Education.
well, what we're trying to do is show that social workers are very vital in the fire service. So we're one of a few, or the only that actually do it like we are doing it. It's common in the police department, but if we're being real, what do you think when a police officer and a social worker show up to your house? Right?
In trouble.
In trouble. But if a firefighter shows up, we're here to help. We're your friends, right? So it's been working out very well for us. And because we believe so heavily in it and our social workers very committed to education, we decided to take on interns, one, to help the fire department with our workload, but to spread the message and get them trained up. So that's an extent. USF was going to use this as a study program as well, but they're having some going-ons over there, so they had to put that off for the moment.
Okay, I was just curious. I've learned a lot and I appreciate you guys being here today. And it sounds like you guys are just going to be super spread thin. But keep at it. You're doing great work.
Thank you. I just wanted a clarification. So, originally this was probably, you getting a lot of repeat calls. You have paramedics that are going out. They have valuable equipment, a limited number of drivers and, paramedics and vehicles. And so in a way to reduce the amount of use for them so they could be freed up to take care of fires, whatever happens, physical things, you've identified a repeat pattern of people who really could benefit from mental health care. And by being proactive, you're able to facilitate and help people to get that healthcare that might not otherwise have reached out to it. It's easy to call 911, and maybe it's not as easy to check yourself into the hospital for these people. So is that about it, what's happening?
Well,
or
it's
did I miss
pretty,
something?
pretty close. It was never about us running calls. That's why we exist, right? There's not a paramedic that you're going to find who's been around. We've been around more than 30 years. And we've all, and same thing with Chief Carey, we always had these patients and these calls where we said, the hospital is not the spot for them. In fact, it might make it worse. They're hungry, they're in crisis moment, whatever the case may be. But we have no other avenue to deal with these people. So how many calls you've been on? We're like, there's something better out there. That is one of the reasons we got this program going, because we wanted to help our community thrive. These vulnerable people who needed help from more than one organization but couldn't get it done. That's why we put this together.
Fair enough. All right. Well, I really appreciate it. A lot of questions. So there's a lot of information that went out. I know that Micah's requested some, and I'm not sure if some other people requested, but if you can get back to us.
No cards.
We'll stick around too if you got any other questions you want answered or you're looking for more information, so we can get it for you, and we'll give you cards.
All right.
Thank you for your
very
time.
much. Thank you. Okay, we're going to go to our next informational report, starting with Kathleen Burke on substance use or use. I don't think we have anything to vote on. Yes. No, that's fine.
Good morning.
Sorry.
So as usual, the report, the PowerPoint is in your packet. What I want to point out is our opioid deaths continue to trend downward. And so again, over 30% compared to last year. So we're I'm really proud. I think our team that works this project does a really great job. Um, And we added 10 new red boxes, which are naloxone distribution boxes to the community. The listing in here is of the locations. I'm really pleased to say that our southeast area of the county has some boxes now. We are really trying to make sure that we reach every portion of the county. So I think that's exciting. And what I really think is exciting is that people are open to it, because a couple of years ago, they'd have absolutely nothing to do with having some box for Narcan for people to come and use. And our boxes are being used more frequently. We're seeing parents who are getting their kids ready for school, college, are sending them with Narcan. That happens more and more. And one of the new locations for our boxes is Lewis University. So we placed them, and we've been working with them for years. We've done education, and I'm really happy to say that they are rather progressive when it comes to offering services for their students. So that's exciting. The fentanyl test strips are also very popular. And we've given out quite a bit of those, and we're going to continue to do that. Those were on the safe list for the federal government, because we're funded through, it's a pass-through to the state, that we are still able to pass out test sticks, fentanyl, xylazine, and so we continue to do that. Our largest event was the end of August, which are Your Light Still Shines. And we had a really nice participation of over 30 vendors. We had over 200 people who attended, and the presentations were by 3 young women that have had, they're either siblings of people who've passed, or they're a child of someone, parents who've had a substance use disorder. And so they were able to represent their experience. It was very, very powerful and very valuable. Again, you talked earlier about forgetting the family. We can't forget the family, because they're definitely impacted by any kind of addiction in the family. And again, we have been all over the county in August. You can see all of our list of locations and some of our proud supporters who helped pass that out. And at the end of your report is a conversation about our peer support program. So the opioid dollars that the county has given us allowed the health department in behavioral health to start a peer support program. Peer support is someone with a lived experience, and in our case, they are certified peer support. So they've taken the classwork needed to be able to sit for an exam, and all of our folks are certified. And we're very proud of that. That means they're very, very good caregivers, and they come high quality. And that program has taken off in the health department. We see the peer support people see both mental health and substance use clients. So there's no distinguishing if a client needs services. And those kind of services are, do they need help getting a license? They don't have a license, so they can't drive their car. Do they need an ID? Do they need housing? Housing is probably the number one. We can't give them housing, but we can facilitate the process that we know in Will County to get housing. We get them started with that. Transportation is another one. We work again with the other agencies in town who are able to provide transportation. Joliet Township is one of them. Also, you can bill Medicaid for transportation. So if those are our clients, we do that. We've had a couple success stories that are in your packet about one gentleman just needed a bike to get to work. And so Xenia Garrity, actually Michelle Ramey, went out of her way to make sure she knew someone who has used bikes, and she accessed that person and was able to provide that person with a bike. Those are the kind of resources this is the kind of work they do, okay? It's a simple resource, but it was his transportation to services as well as work, and it was a simple fix. But if you don't have anyone there to do that, then those things don't get answered. And that's the basis, that's my report. Sorry about that. Any questions? Do you have a question?
I
What you-
do.
Oh, okay, I'm just
Oh,
trying to
Julie has a
establish a
question.
pattern here. She was giving me eye contact.
Oh,
What was
I
happening?
can't do that unless I do
I
this.
was
'cause I'm in my
trying to,
chair.
you know, so I didn't want to be disrespectful.
Thank
to
you.
her.
Kathleen, just a question about the reporting. So these numbers from the Will County coroner, I noticed like on the graph, they don't include all of Will County residents. This is just, are these just the
These are the
numbers?
people who die in Will County, who pass away and
Okay,
the
but-
coroner takes care of Will County.
So it's just the coroner it's not cases that wind up in the hospital or,
Well, these cases are from the hospital. I mean, it's
Okay.
everybody who dies
Okay.
in Will County.
but we obviously don't get any reporting then if it's a resident, a Will County resident, however, they're taken to another county such as DuPage County. We're not getting that report.
No, if they pass away in DuPage County, then DuPage County reports that because that person goes to their coroner.
Right, but if it's a Will County resident, Will County is not notified of that.
No,
They're not notified that a Will County resident has passed away.
Well, wait a minute, just so I interject, there was a time when that did not happen. On Collar counties, I believe they do report deaths. They don't report overdoses, but they will on Collar counties. So if they were to skip, you know, to the next county, then no, they wouldn't get reported. But there was a time when if you died outside of the county, it didn't get reported, but I believe there's an agreement with Collar counties. Just
Well, no,
like
there
that.
obviously isn't because Naperville is not reflected on the slide. So, and it typically never is. So is there a way for us to, I mean, if we have a resident who's, you know, a victim of suicide, that we can include that in our data, even if they're taken to DuPage County? Because right now we're not reflecting on that.
first of all, my report focuses on substance use and opioid overdose. I report the suicide rate because it's on the coroner's report and it's valuable information for all of you. A situation where one person who might be, Naperville split up into Will County and DuPage County, correct? So, so if someone passes away in that county, then they become the responsibility of that county. And just as the nuances are, that even though people might have an address in Will County, that doesn't mean they've been residing in Will County for very long. So you see people who may pass away depending on their circumstances, right? You'll also see people who, if they've traveled a distance to get their substances they've used, they may pass away because the substance was toxic. So are you worried that one person is being underreported?
No, and over the years, it's not just one person, but they aren't being reported. And so what I'm asking is there's no,
If they're Will
There's-
County residents and they die in Will County, they are
No, no.
reported.
correct, but there's Will County residents that they don't die in Will County. They're 2 blocks away and they're taken to DuPage County. And I'm just asking if, you know, there's no communication, but obviously between the coroners.
It's really up to the family. And the coroners take care of the
Well,
person who's passed.
there's no reporting requirement between the DuPage coroner and the Will County coroner. And
There is
that's
a-
not up to the family. I'm just trying to understand how.
I think you're better off talking to our coroner about the specifics. I don't
Mhm.
feel that I'm the best person to explain the interaction they have with the other coroners because I
Okay.
don't know, and I know they meet.
Maybe that would be, I'd love to have the coroner come here and meet with us and give us a presentation. We
you
used
know
to
what?
have that every year.
I will,
Thank you.
I will take that request and I will put that in and we will hear from her for you. All right, thank you. Micah, you have the floor.
Good morning.
Good
It's still morning. I just have a real quick question, Dr. Burke. The peer support
Mhm.
program, how many are participating?
You mean clients?
Yeah.
I don't have that number in front of me. I can get that number for you.
Is it increasing? Is it?
Yes, it's definitely increasing because we started out with one person and now we have two people and they're both busy and we are very, very pleased. So but I can, the next time I can report on what that volume is for you.
There's no rush. Thanks.
But believe me, they're.
I was just curious
busy.
because it sounds really positive and I was just
And our peer
curious how many
support
was in there.
folks are billable, so they are billable service. So even though the opioid dollars are funding it, they're all partially self-sustaining too. So we're very, very pleased and we're very happy about the support that we receive.
Lovely. Thank you.
Well, thank you very much.
Thank you. I'm going to leave this on for the next speaker.
Yep, next, Maggie McDowell for Sunny Hill.
Good morning, everyone. Everybody should have a copy of my report. It's basically informational in nature. Of course, we've had a very, very busy summer. We've been enjoying the outdoors and we're very blessed that we have many beautiful outdoor areas for the residents to enjoy. We have also been undertaking a back to school drive. I know the kids are back in school now, or at least I think most schools are open, but we are continuing the back to school drive through the end of September, and we've been getting a really good response. So we appreciate that, and when that's done, we will be, donating all those supplies to one of our local schools. One of our big events of the year is actually coming up. Our Alzheimer's Walk will actually occur on September 19th, starting out on campus at 10 a.m. So we do get a really good turnout of all our residents. Our staff push the residents in their chairs around the campus. Our families participate in that. And then we do have a lot of outside support coming in as well. So please, if anybody is available on that date and at that time, please join us. This is a very, very important event. It's really about increasing awareness and it's also a fundraising event. So there is an email included. And if anybody would like to donate, we do have a target amount of $2,000 that we're aiming to reach. So please, if we can look for support, that would be very much appreciated. The other event that's coming up that's really important for our residents is Grandparents' Day, and that's coming up this weekend. So it is usually a big celebratory event, and the families do turn out. It depends on the weather. It may be an outdoor event. If the weather is a little cooler, it may actually be an indoor event. But either way, we'll be celebrating with our elders. And then last but not least, we've had actually 3 interns over the summer, basically. We have been taking interns in social work, and they've been working with our group of social workers and also our life engagement department. We've had social workers from both Lewis University and St. Francis, and this has actually been working out wonderful for us. The positive spin on this is one of our social workers, our existing social workers, was promoted to be a director of life engagement, and that opened up her position. And actually, one of the interns had just spent a year with us, actually applied for the position and just slid right in there. So it worked out very well. And we've had a great experience. Our social workers, our existing social workers, do a phenomenal job with bringing these interns in and kind of showing them the ropes and giving them a very positive experience overall. So that's, like I said, right now we've had 3 over the summer, and for the most part for a year, and we're looking at 3 new ones have just started, and they'll be with us through probably the end of May or beginning of the summer. So yeah. Anybody have any questions for me? Otherwise, that concludes my report.
Okay, we have one question.
Yes.
I hate to ask, I'm so tired of asking. Can it just go away? COVID is on the rise. How are we doing?
Okay, respiratory wise, we have seen an uptick at the facility in terms of upper respiratory type illnesses. The quandary right now and the anomaly is that we've not been able to pinpoint what that is. We have tested our residents for everything. We do an extensive respiratory profile on residents that present with, any type of respiratory issues, cough. What we've been seeing is residents presenting with a cough and a sore throat. Those are the two predominant symptoms that we're experiencing. The concern is that it's very quickly changing, which we've not seen before, to a pneumonia in those residents. And it's been requiring a send out to the hospital for further treatment because they have been decompensating very quickly. Now, we are working very closely with Will County Health Department. Well, our infection control committee has met on this, and obviously we're taking all the precautions necessary within the facility. We're working with the Will County Health Department. We're working with our medical director, Dr. Shaw. We're also working with infectious diseases and Illinois Department of Public Health because we've not been able to define what exactly is going on. It's not testing positive for COVID. It's not flu. Although we very early on, we had a couple of cases of parainfluenza that was introduced because we had admitted a resident from a hospital, but that was 4 cases. But other than that, we've not been able to define what and why the increase in respiratory issues. And we've not seen this previously. So we are we've been working on this over time and obviously our surveillance and working hand in hand with the health department. Nobody's been able to define what's going on. I think it's a precursor maybe to, we're now going into flu season. It's very confusing, and even to the experts in the field in terms of infectious diseases, they are very much on board at different levels, kind of keeping a close eye on this because as such, it's undefined. And that's, I guess, the concerning issue. If we could pinpoint and say, this is COVID, this is here, we can name it, we know what we're dealing with. Right now, we don't. And I think that in of itself is concerning.
So you are kind of describing exactly what my daughter has right now. It started off, the doctor thought it was just like a sinus infection. They tested for everything.
Yeah.
And now it's a week later and she's deathly ill, can't stop coughing, congested. Now
And that's
he
what
just
we're seeing.
prescribed her a medication and a black box that says, don't be cautious on the stairs, which it just blows my mind.
Yeah.
But
And this
so
is
you said there were some hospitalizations. Has there been any deaths related to this?
No, there has been, like I said, of course, as their condition deteriorates and they desaturate and, the condition becomes more acute, then obviously we've sent, our residents to the hospital. And again, the anomaly too is, is it viral? Is it bacterial? What's going on? And for the most case, you don't treat viral illnesses with antibiotics, but the strange entity here is they've been responding. Our residents have been responding to antibiotic treatment. So, like I said, it's something we're looking at very, very closely and monitoring very closely.
Well, geez, thanks. Now I have something more to ask for you. Thank you very much.
Okay. Thanks. Anybody have any other questions?
All right.
Okay.
Well,
All right.
Thank you very much.
Thank you.
Appreciate it.
We'll keep you updated.
Well, last but not least, she's been patiently waiting, Elizabeth Bellata. We welcome your report. Oops.
Almost good afternoon. Good morning.
Morning.
Yes. So thank you again for letting us present. I just wanted to make a couple notes and then I'll go into my report. Please keep in mind that September is National Preparedness Month. So on behalf of our Emergency Preparedness Division, we just want to encourage everyone to prepare for emergencies ahead of time. Also September, we've been talking a lot about behavioral health. So September is Suicide Prevention Month. And Governor Pritzker also signed a proclamation declaring September the National Recovery Month to celebrate the gains made by those in recovery from behavioral health challenges. So I just wanted to make a note that September has a lot of different things that we need to look to. So if you go into my report, I'm assuming you read through it. The one thing I just really wanted to highlight is the very first thing was our I-Plan. So as you know, we are a certified local health department and we have to do a needs assessment of the community every 5 years. So we did submit our plan to Illinois Department of Public Health on August 8th, and we are eagerly awaiting their approval. They said they take about 60 days to review it. It does include our community needs assessment and our community health improvement plan. And the items that we are going to be working on for the next 5 years include the access to food and nutrition, maternal and child health, and then behavioral health and substance use. And we do have action teams ready and already started and meeting monthly to go forward and move forward with those initiatives. As Dr. Burke had mentioned, we have added some new naloxone distribution boxes, and that we timed it along with the week of August 25th to August 31st was actually Drug Overdose Awareness Week. And then August 31st was International Overdose Awareness Day. So we did time our press release with that. So we had one come out right after that regarding the extra 10 boxes that we have put throughout the county. Right. I also just wanted to bring up that we are opening, or we have opened an expanded suite for behavioral health and community health center in our Bolingbrook office. And hopefully you did receive the invite. We are having an open house on September 29th. So please, if you have time to stop by and see our facilities. I also wanted to talk a little bit about our health equity events. As you know, our health equity manager and his team of navigators are in the community nonstop going to events. And we just finished a large event, the county fair. So we did have quite a few individuals. We had 2 tables, one for environmental health and then one for the rest of the health department, not far from the county board table. Also, our health equity manager they have been working closely with Age Guide of Northeastern Illinois, and we are doing a social connectiveness campaign with them to focus on seniors and others that are socially isolated. So that campaign is actually going forward right now. Another mention at our community health center, the week of August 3rd through August 9th was National Health Center Week. And the focus of that this year was America's Health Centers, celebrating past, present, and future, celebrating the 60 years of health centers being around. So that was a wonderful celebration for our community health center. Another thing I wanted to highlight is that our directors from Family Health Services were selected to present a poster at NACHO's, which is the National Association of City and County Health Officials Conference that was in July. And their presentation was on what we call Lunch and Learns or Community Connections. It's a presentation that they have teamed up with the school nurses and with other entities in the county where they provide education on a monthly basis on a topic that is relevant to the nurses and to schools. And then let's see, I just wanted to point out one other thing is that our immunizations program continues throughout the summer. We were doing school clinics, and we highlighted in the report some of the schools that they had attended to make sure that the kids had their vaccines that were necessary so they were not excluded from class when schools started in August. And then our environmental health division is having our chemistry certification from Illinois EPA, September 15th and 16th. So we're looking forward to the EPA coming in and looking at all their processes and procedures. And once again, under behavioral health, I did want to highlight the back to school fair that our behavioral health division had on August 8th. We received donations from hospitals and libraries and local agencies, and we had over 280 families registered to come to this back to school event. It was a wonderful success. We had vendors, and everyone got backpacks and rulers and crayons and markers. So it was a really big success for us. So other than that, do you have any other questions regarding my report?
No, you're going to be shocked.
No, yes, we do have a question.
Okay.
It's more of a comment. I was at the Will County Fair. I loved your little tick removal kits.
Oh,
They
yes.
were a big success. Saw lots of people carrying those around. But the other one I was hoping you would mention and you didn't was that you had some interns that were
Oh,
followed
yeah.
by a news crew.
I'm sorry.
If you don't mind
I think-
sharing that information with
I
this
may have even
committee,
given
I
you
think
the
that
link.
that was exciting.
Yes, so maybe it was, it was in here. So we have interns that work for us every summer and they do the West Nile virus program and our swimming pool and beach program. And so we had Channel 7 come in and they were looking at our interns as an opportunity for other, students in the area. Hey, you can come to the health department and do these things. So they followed our interns around, as you mentioned, and they collected the mosquitoes from the traps. They watched them test them. And then we actually did make the news. And right after that is when I think we got our first positive mosquito batch too. So we reported that to them. But it was very exciting to see them on the news. So
And you
I
can
thought
see
it
it
had
on the
included
link.
a
I think it was Channel 2.
I think it was Channel 2. Yeah, I believe.
Yeah.
But I thought I had included a clip of that, but maybe that was the report before.
Yeah, if you could get it to Chuck, he could share it with us. I can
send you the clip.
celebrate the little wins. And
We
just-
played it at the Board of Health, correct?
Right.
Yes.
And just one real quick question. I know that the COVID vaccines have been put on hold. And I know that some states are choosing to disregard that halt. And I'm just curious where we are standing with that.
Okay, well, I will defer to Sylvia to come on up, or Cheryl. At this point, we do not have any vaccines. I know we also on Monday are meeting with our medical director along with our community health center and FHS. And we are going to be discussing what are the recommendations that are coming down, because right now you are correct. There's a lot of different recommendations coming down, not only for COVID, but for RSV and for the flu shot. And we want to make sure that as an agency, we are following the correct recommendation for our agency.
I have
Oh.
nothing to add to that.
Okay.
Elizabeth,
So right now
okay.
there is none, not even for 65 or older?
We do not have any at this point
Okay.
available.
Okay. Then I won't send 65 and older there.
Sorry,
Yeah,
yes.
we're actually discussing that tomorrow. We're actually discussing that tomorrow with Dr. Garganera. We have a whole crew to figure out exactly what we are going to follow.
Okay. Thank you.
Okay, well, I did have a question to just kind of off of one of your, what was this about the ticks that? No, I brought this up early on because this is a problem that, people who, come down with that Lyme's disease and stuff, they don't, it's really hard to treat. A lot of them, they say that if you have a double dose of antibiotics, but nobody prescribes that if you catch it early enough. But I have noticed, and I'm sorry, an uptick in the population of these little critters. I couldn't help it. But is there an increase in this?
I don't know if I can confirm the increase. However, the Environmental Division did get a grant to do a tick surveillance. So they do a tick drag periodically through the seasons, and then they send the ticks into the state for testing. The last tick drag that we did submit the ticks in, and we have actually, the results are still pending. Unfortunately, I don't have the results of that. But I do not know if there's an uptick in the tick population, but I could look into that for you.
She couldn't resist either.
But I will look into that, sir.
All right, thank you very much. If there are no more questions, thank you.
They
Right?
do have really cute tick removal kits.
Well, it's important to do it properly so that the head of the tick does not remain in, you have to remove the entire tick. So it comes with instructions, it comes with a little tool, and it also comes with a antiseptic and a Band-Aid to put on. So we have them if anyone is interested.
Yeah.
Okay.
Well, thank you for your
Thank you.
presentation.
Thank you.
And I'm assuming, well, I should not assume, is there any public comment still? No public comment? We got a lot of public comments earlier, so, one more time? No, no public comment? Okay. Any announcements or reports by chair? Okay, that's me.
That is.
I'm just gonna say, I'm sorry if I seem a little pushy or rude during our meetings, but sometimes they go on for quite some time. And I think, we gotta write our questions down, maybe 2 or 3 questions at a time, and maybe not too much speech making, just concise questions, and then, once it's answered, next question. Just because we are going on 2 hours now, so, and then people are waiting, and they got, jobs to get back to and patients to attend. So I will step it up a little each meeting to try to keep us on time, so. Okay, can I get, we don't have any executive session, and so I just need a motion to adjourn.
Motion for boards.
All in favor?
Next meeting.
Yeah. Next meeting is scheduled for October 2nd, 2025.
Yeah, I had lots of questions for